So as to date, the only treatment for myelofibrosis that is shown to lead to long-term maintenance-free survival is allogeneic hematopoietic stem cell transplant, or transplant for short. And the challenge often with transplant is that patients with myelofibrosis can have very large spleens, they can have very poor functional status. And are there things that we can do to optimize a patient prior to going to transplantation? And so the question is, in this abstract was, can Fedratinib potentially serve in that role to kind of reduce the burden of illness and optimize, if you will, a patient prior to transplant? So we did a healthcare claims database looking for patients who had myelofibrosis, who were on Fedratinib and then ultimately went to transplant to kind of gather information in an exploratory way of those outcomes with transplant. And we saw that yes, Fedratinib can certainly serve as a vehicle or a bridge to get people to transplant and used to optimize people prior to transplant. The criticism of this work is that it's very small, but again, it was a pilot and it was exploratory analysis, and certainly we'd like to replicate this in a much larger scale.